Do you want to impact the lives of the people who served our country? If so, listen in. 28% of the general homeless population has reported a suicide attempt over their lifetime. The proportion among homeless veterans may be as high as 46%, and the rates of death by suicide higher in veterans with housing instability. Multiple risk factors, including extreme poverty, lack of housing, loneliness, high prevalence of psychiatric, physical, and cognitive comorbidities exist to account for these high rates of suicide. Working with populations that have a greater propensity for multiple comorbidities, extensive trauma history, and housing instability is key to decreasing suicide rates among homeless veterans. Traditionally, efforts to prevent veteran suicide have primarily targeted those receiving care through the Veterans Health Administration. However, this approach has limitations. Many veterans are ineligible for comprehensive VA services and must rely on community-based care outside the VA system. Consequently, concentrating solely on veterans who use VHA services restricts the reach of these suicide prevention programs, potentially overlooking a significant portion of the veteran population at risk. There are a number of areas that need enhancement in order to improve suicide prevention initiatives. First, suicide prevention must be prioritized across all levels of care. The DNP leader can foster collaborative decision-making by adopting a participative leadership style, as described in Path Goal theory, to incorporate team members' input into policy formation. Research is scarce regarding the specific factors influencing suicide risk among homeless veterans and how these factors may differ from those affecting suicide risk in other populations. As a DNP student, I advocate for increased research on suicide risk among homeless veterans to improve detection and intervention. Additionally, I propose expanding and promoting mental health and housing services for this population to reduce suicide rates and increase service utilization. Thanks for listening.